Welcome, everyone. My name is Emily, and I am from Benefit and Financial Strategies. And I would like to introduce to you Arren Asmus, who is our trusted health insurance consultant who will be discussing Medicare with you all. He's very knowledgeable and has been in the industry for over 5 years. Welcome, Arren.
Awesome. Thank you, Emily. And welcome everyone to Medicare 101, brought to you by Benefit and Financial Strategies and Physicians Mutual, whose material we'll be using today. They are one of the companies that we have contracts with, one of the many, and we'll go ahead and get started with the presentation. All right, so what we'll be talking about today, we're going to be talking about transitioning from employee to retiree benefits, enrolling into Medicare, what the different parts of Medicare are, and in the end, how you're going to pay for your health care when you're retired. Now, what is Medicare? Medicare is a federal health insurance program for seniors and other individuals with certain medical disabilities. It's often confused with Medicaid, and Medicaid is a federal and state-funded health insurance program for people with limited resources. And that's just the difference between the two. Now, signing up for Medicare and Social Security benefits do have a similar process. You're going to need to go on to www.ssa.gov by phone at 1-800-772-1213, or you can apply in person at your local Social Security office. However, COVID restrictions do apply, and be sure to bring any of the listed items. Go ahead and pause the presentation right now if you want to take down this list further. Next slide. Now, should you enroll in Medicare is a big question, why we're all asking ourselves. If you and your spouse are currently working and you receive your health insurance through an employer, you are not required to enroll into Medicare at age 65 if the plan that you have is a qualified plan with Medicare. And that can be found out with your your human resources department, and they will just let you know, hey, yes, it is qualified, or no, it's not qualified, and then you can proceed from there. When you or your spouse retire, you will have a special opportunity to enroll in Medicare without penalty that some people say that you're going to pay if you don't enroll in Medicare on time. However, your spouse and your family, if they are included on your health insurance, you will need to keep working to retain that coverage if that's your situation, or go on to Medicare. Or go on to Obamacare, because Medicare will not cover family members unless they qualify on their own through special situations or are already over 65. But if your spouse is younger, you may need to keep working to have that coverage for your spouse, or pick something else up. Now, basics of Medicare. It was created to help pay medical bills. It started in 1965, and it's run by Centers for Medicare and Medicaid Services. It's mostly for seniors, but others with certain disabilities and situations do qualify. There was the Medicare Modernization Act of 2003, which put Med Choice plans to Medicare Advantage plans, and more alterations were made to Medicare in the Affordable Care Act area of 2010. For more information, refer to the Medicare and You handbook that is actually available on Medicare.gov, and we can get you a copy of the Choosing a Medigap Policy booklet through email if you do request it. Now, what are the different parts of Medicare? There are 4 parts to Medicare in and of itself. There is Part A, that is hospital insurance. Part B is medical insurance, and both Parts A and B, when they're active, are considered original Medicare. Part C are Medicare Advantage plans, and Part D is solely for prescription drug coverage. Now, signing up for Part A. You are automatically enrolled for Part A when you're receiving Social Security benefits and you turn age 65 years old. Most Medicare beneficiaries pay no premium for Part A. It's only people that paid fewer than 40 quarters or 10 years of FICA taxes that pay a Part A premium. If you don't buy a Part A when you are first eligible, your monthly premium may go up 10%. Everyone pays co-pays when using Part A, using those services in the hospital or those other facilities. And if you're not taking Social Security and you are age 65 years old, you need to sign up for Part A by contacting your local Social Security office in person, by phone, or online. Can definitely help you out with that process. Now, if you need to sign up for Part A, you can sign up only during these following times. You have your initial enrollment period, and that's when you're turning 65 or transitioning from a qualified group coverage. Your general enrollment period, which is January 1st through March 31st, which is every year, and a special enrollment period, and you can always see if you qualify for one of those, and we can help you with that as well. Now, Part B. If you get Social Security benefits, you will automatically get Part B, starting on the first day of the month you turn age 65. But your Medicare card should be enrolled to you about 3 months prior to the month you're turning 65. So you're definitely going to want to look out for that card. But if you're not collecting Social Security, then you do need to sign up for Medicare Part A and B through socialsecurity.gov, and we can help you with that too. If you don't want Part B, follow the instructions that come with the card and send the card back. You just sign the back of the card and send it on back. Now, if you didn't sign up for Part B when you first became eligible, you may be eligible to sign up during one of these times rather. General enrollment period, January 1st through March 31st of every year, and the coverage would actually begin July 1st. It's a kind of a little penalty the government gives you, or a special enrollment period. Again, if you are age 65 or older and up for Part B, you have a 6-month Medigap open enrollment period, which gives you guaranteed issue to buy any Medigap insurance policy that those companies have in that 6 months period, with no medical underwriting or cause for conditions to charge you more. Now, your Part B premiums, it's deducted straight from your Social Security. And if you're not collecting your Social Security or waiting till your full retirement age, they do bill you quarterly. Premium is indexed to beneficiaries' earnings, and it does go back 2 years' earnings. These are the limits for 2021. The limits for 2022 have not been released yet at the time of this recording. As you can see, the average income for those individual filing $88,000 a year or less, or joint annual of $176,000 or less, is $148.50. And you can follow the slide to see what your premium would be. Again, this is 2019's return. They always look back 2 years. Now, the Part A benefits. Now, you have a benefit period deductible of $1,484. After Medicare will pay 100% for the first 60 days of your hospital stay. Medicare will pay all but $371 days 61 through 90, and then $742 will be your responsibility for days 91 through 150. Medicare is going to pay nothing for days 151 and beyond. And most Medicare coverages stop at that point too, where it's up to you to pay out of your checking, savings, IRAs, 401ks, and all your other places that money hides. Other Part A benefits are skilled nursing facility care, where you must meet Medicare's requirements. You must have a hospital stay of at least 3 days, enter a skilled facility within 30 days after leaving a hospital, and you must need skilled nursing services care at least 7 days a week, or skilled services at least 5 days a week to get those skilled nursing facility benefits. Medicare will pay 100% less that original deductibles for the first 20 days. They're going to pay everything but $185.50 for days 21 through 100, and then it's up to you with a Medicare supplement to pick up that cost. After 100 days, the Medicare supplement stops paying, and so does Medicare. So again, it's up to you to pick up those costs. Additional Part A benefits are blood after the first 3 pints, home health care, benefits for medically necessary skilled care and medical supplies, hospice, and benefits for inpatient for respite care and related outpatient drugs too. That's all covered under Part A. So this is the healthcare pie, and it's most things that you're going to see for medical services, from acute needs on the right to chronic needs on the left. And you can see how Part A would fill in some of those gaps. Now, Part B benefits. What do you get for Part B? Those are all your medical benefits. You get a welcome to Medicare visit. You have limited preventative services, inpatient and outpatient doctor services, surgical services and supplies, speech and physical therapy, diagnostic tests, and durable medical equipment, along with ambulance services, all covered under Part B. There is an annual deductible for Part B, and for 2021, that is $203. The annual deductible for 2022 has not come out yet, but it is an annual deductible. It's not looked at as a benefit period deductible like Part A. After you meet this $203, so in essence, after you pay the first $203 of your medical visits, Medicare pays 80% of the eligible coverage charges, and then 100% of Medicare covered clinical laboratory services for blood tests or diagnostic services. It does cover varying amounts of preventative services and nothing for any charges in the excess of the Medicare approved amount at specialty clinics like the Mayo or MD Anderson, Cancer Centers of America, or America's Heart Institute. Places like that charge a little bit more than Medicare doesn't cover. It's up to the plan you choose to cover those. What Medicare does not cover. Medicare does not cover, which is Part A and Part B. They do not cover routine dental, vision, hearing, and foot care. They don't cover long-term care like in a nursing home, alternative medicine, elective cosmetic surgery, personal care, health outside the US, prescription drugs, or non-medical expenses. It's up to you to find the coverage for those portions of exposure. So this is that same healthcare pie with original Medicare Parts A and B and what they kind of cover. Now, Part C are all Medicare Advantage plans. Once you're enrolled, you're actually removed from original Medicare Parts A and B. You're now insured with a private insurance, which means it's a private health plan, not supplementing the federal government insurance. It normally comes with network restrictions, and those networks can also change from year to year. This is what you hear about PPOs, preferred provider organizations, HMOs, which is health maintenance organizations, and PFFS, which is private fee-for-service organizations. All Medicare Advantage plans are optionally renewable every year. Your out-of-pocket costs can change over time, and you actually cannot purchase Medicare supplement insurance to cover the extra costs of the Medicare Advantage plans. Now, Part D. Part D is a prescription drug option run by private insurance companies approved and under contract with Medicare. It helps cover the cost of drugs only, brand name and generic drugs. It may help lower your prescription drug costs and help protect against higher costs in the future. But Part B does not cover non-prescription drugs, weight gain or loss, fertility, cough or cold, hair growth, your cosmetics, and most vitamins and minerals. And if you don't sign up for a Part D as well, then you also are charged a premium on a penalty on that portion as well. That is a lifetime penalty. So as you can see, Medicare alone leaves you with some exposure, and Medicare alone is not enough. Medicare Part A and Part B have no yearly limit for what you pay out of pocket. So your options to help pay your medical expenses in health and in retirement are original Medicare, which is only Parts A and B, original Medicare, Parts A and B, and then Medicare supplement insurance, privatized Medicare with networks like PPOs, HMOs, and PFFS, and then adding a prescription drug onto these plans to help you cover the expenses for drug costs. As everybody knows, different options meet different needs, and that's where it's up to you to have an individualized health plan built to tailor your personalized needs. So what do you do now? Everyone has different needs and situations. As a licensed agent producer, I can help you answer the questions that you're going to have. And when we meet, I will help you choose the right solution for you. Now, if you do have any questions, we welcome those additional questions via email or would love to have a phone conversation with you. So please feel free to contact us, and thank you for your time.
Thank you everyone for joining us today. If you would have any questions, you can give us a call at 928-774-0695, or you can also leave a comment on our website and we'll get back to you.
We're at 16 minutes.